Thank you, Acting Speaker. I rise today to speak on the Health Services Amendment Bill, Mandatory Vaccination of Healthcare Workers 2020. And I'm pleased to follow the member for Essendon and the contributions of other members in this chamber, and I'm pleased that there's no opposition to this bill. The introduction of this bill comes at a time that the community has a great awareness on the need and the benefits that vaccinations provide to keeping our population safe. The last few flu seasons here in Victoria have seen an increased severity in the symptoms of the flu and seen the devastating effect on particularly vulnerable members of our society. Aged care facilities where the transmission of the flu can easily occur saw a particularly concerning amount of cases with the 2019 flu season. 268 outbreaks, 3,611 residents cases, 357 hospitalisations and 138 deaths as a result of influenza hitting our aged care facilities in 2019. In 2017 was another horrific flu season that saw increased deaths in the community. Children and young infants in particular are another demographic that are vulnerable to a severe flu outbreak. Once upon a time, flu was seen as not much worse than a cold and something that you could just shake off. The last few flu seasons and recent events have shown us that the severity of symptoms can be a real concern for Victorians. Often at the peak of the community being exposed to an outbreak, it coincides with naturally an increased rate of people seeking medical help. Victoria is served by amazing healthcare workers. I had the privilege to lead many of them heading up the Victorian Ambulance Union and serving as a paramedic. Victorians should be proud of the many healthcare professionals and frontline staff that work hard each and every day to provide Victorians with high quality healthcare. And I want to thank all our healthcare workers for the jobs that they do. These hard workers constantly put the need of others ahead of themselves. They care for those who seek their help at a time in their lives when they feel very vulnerable. In the height of an outbreak, when people are seeking to help, it's important that our healthcare system is protecting people and the community as a whole by not inadvertently passing on vaccine-preventable diseases. Of course, with vaccines, we know that a herd immunity is an effective way of helping protect that community, especially those who are unable to receive vaccines due to allergies or a weakened immune system. We all have a part to play in protecting the community. The Andrews Labor government has a solid track record in promoting and encouraging vaccines. The no jab, no play policy has seen more Victorian families immunising their loved ones and protecting children whilst learning has been a success. Victoria immunisation rates are still the highest of Australian states. The Andrews Labor government stands up for healthcare workers in Victoria. Protecting frontline staff from preventable diseases is a priority for this government. Currently, influenza vaccination is funded for staff working in health services, and healthcare worker influenza vaccination rates have risen in the last few years, peaking at 84% last year. One of the reasons healthcare workers choose to work in the sector is because they care for the people that they come into contact with, doing their day-to-day tasks. Vaccinating to ensure that they are not passing on an infection to the people that they care for is an important measure to protect Victorians. Currently, Victoria is one of the few jurisdictions in Australia that doesn't yet have a mandatory vaccination requirement for healthcare workers. The overwhelming majority of healthcare workers here in Victoria do the right thing to protect the people around them by vaccinating themselves from preventable disease. However, not having a mandated policy leaves open the potential for risk to those who can't be vaccinated for a particular reason. It is essential that the healthcare system in Victoria not only protects their staff, but of course all Victorians by ensuring that healthcare staff are not inadvertently passing on preventable diseases. The science is undeniable. Vaccines save lives. It's unfortunate that saving lives is hijacked by misinformation and deceit by some claiming to provide accurate information but spread dangerous misunderstanding of the science and the facts. There is no mere misdemeanour. The consequences of this deceit and misinformation can have devastating consequences. There can be no greater example of this than recent events with the devastating measles outbreak to inflict Samoa last year. Misinformation around vaccines in Samoa had led to a drop in vaccination rates to around 31%. When measles broke out, the catastrophe that followed ended with at least 20% of babies aged 6 to 11 months contracting the preventable disease. 1 in every 150 babies in Samoa died. Out of a population of just over 200,000, there were 79 deaths. Every single person in the tight-knit community were affected in some way. Everyone knew a family member that had lost someone. No doubt that in the rush to vaccinate and protect their families during the outbreak, many may have been exposed to measles whilst trying to access medical treatment. Those seeking medical assistance unrelated to the outbreak could have been exposed at that time. And there is no doubt that during an outbreak, an important protection to the vulnerable is a healthcare workforce that is immune. A workforce that is able to turn up to work during an emergency, a workforce that is protected from harm, and a workforce that protects the people that they are caring for is essential. It is important to note that mandated vaccination will not only occur unless the Secretary of the Health and Human Services makes a declaration to health services under this bill. It is intended that that declaration to do this won't occur until early 2021. This time will allow appropriate consultation and implementation with those who this bill affects. I would like to acknowledge that in the lead up to this legislation being discussed here in this place, that my office has been contacted by a number of individuals concerned with this legislation. Some of these have been from genuine healthcare workers. Some I suspect are part of the usual suspects that tend to get involved with any announcement that this government makes when it sets to protect vulnerable Victorians from easily preventable diseases. In much the same way that we have protections in other areas, it is essential that protections in our health sector are in place too. Working for children checks are now mandated in Victorian schools, childcare and sporting clubs to protect children. This is similar in that it sets out a requirement to protect patients. In my experience as a paramedic and an ambulance union official representing paramedics is that the overwhelming amount of healthcare sector workers do the right thing by protecting their patients and themselves by using scientifically proven vaccines. The entire reason for the healthcare system to exist is to provide care to those who need it. Patient safety and care is the reason people make the decision to seek a career in healthcare. Putting others at unnecessary risk is not acceptable. Protecting Victorians is something that this Andrews Labor government makes no apology for. A recommendation of the 2016 Ducat Review into hospital safety and quality assurance in Victoria found that the Department of Health and Human Services should have stronger oversight of the health system and provide greater support to hospitals. The report recommended that legislative powers of oversight or intervention can be exercised to identify and respond to quality and safety risk. This legislation is clearly in line with this review. This protects workers and this protects patients. Last year's flu season was like no other. There was an enormous strain on our hospitals and ambulances, with more than 69,000 laboratory-confirmed flu cases. Many more cases, of course, would have gone unreported. Last year, we also saw more than double the number of measles cases in 2019 than what we did in 2018. And as I mentioned earlier, this had a devastating and tragic consequences in Samoa and our Pacific neighbours. And many families in my electorate of Melton with Samoan heritage know the hurt and pain from losing family members in Samoa last year due to the measles outbreak. We had a large year for whooping cough. There were 2,210 notifications compared to 1,700 in 2018. Some good news we have seen recently is that our healthcare workers protecting themselves and the people they care for in 2019 reached an 88% flu vaccination rate in our public health services. The government is committed to making sure our healthcare workers are among the first to be immunised each year by making the flu and other vaccines mandatory for healthcare workers. This health minister and the minister before her have a strong track record when it comes to immunisations and vaccines, advocating with the federal government to ensure supplies in Victoria are available and putting in policies to protect our children and vulnerable in society. I congratulate them on their strong track record and their continued commitment to vaccinations and immunisations in Victoria. There is no question about it, vaccinations is one of the most effective ways of preventing disease worldwide. Reducing morbidity and mortality from many infectious diseases by means of vaccination has been described as one of the most significant public health achievements of the past century. It is clear that vaccinations are safe and it saves lives, and I commend this bill to the House.